As the number of coronavirus cases rise across the country, so does another disturbing statistic: the number of preteens and teens going to the ER for mental health issues. The pandemic and the pressure of learning from home are apparently taking a toll.
KCAL 9 consumer investigator Christine Lazar has the startling numbers and what can be done to help.
A report from the Centers for Disease Control shows the toll that COVID has had on our children. The CDC analyzed data from 47 states and found that from March to October, mental health-related emergency room visits increased 24% for kids ages 5 to 11 and 31% for kids ages 12 to 17 from the same time period last year.
And that is astronomical, but it is in line with what I'm seeing here in my practice.
Dr. David Swanson is a licensed clinical family psychologist in Encino. He's seen a spike in anxiety and depression in his young clients. He says there are 6 contributors to this mental health crisis.
And the first thing is this idea that there isn't an end in sight. I think that most of us can endure some pretty horrible conditions so long as we know that there's a date when it will end.
And those feelings are compounded by their young age.
If you took a 13-year-old and you basically had them locked down for a year of their life, you're talking about 8% of their life.
Other contributing factors are a lack of routine and not being able to see their friends in person.
Hanging out with your friends and having a social life is one of the biggest things kids can do to fight against anxiety and depression.
Also, boredom and monotony are to blame. A lack of schedule and their young age leading to a lack of point of reference.
Most of us have gone through a major earthquake. Most of us have gone through 9/11. We're aware that things get really bad in life, but we also know that time heals.
Finally, kids are picking up on their parents' anxiety and fear. But there are ways to help your kids, including having open and clear communication, making sure teens get 8 to 10 hours of sleep a night, sticking to a routine each day, exercising, offsetting screen time by getting kids outside, forming a pod so kids can see their friends, and watching what you say in front of your kids.
If what you say in front of your kids is a message of anxiety or it's more of a depressed message, they're going to internalize that and they're going to take that on. So you need to communicate messages of hope.
The CDC's report also found that more girls are going to the ER for mental health related issues than boys. Christine Lazar, KCAL 9 News.